Okay, so today we are talking about the new biostimulated treatment called Sculptra. And firstly, we need to look at what Sculptra can do for us. As we get older, we start losing collagen in the skin, and that leads to an increase in the skin's laxity, which results in sagging. So I've asked Sister Elise to explain to us what the problems are that she is identifying in her face and with her skin. Elise, for you, what are the major things that you think we should start working on?
I definitely think we need to work around my mouth. My mouth hangs, or my mouth corners hangs, and it makes me look angry all the time. I don't like that. And then I've got fine lines as well, deeper wrinkles and fine lines on my lower face mostly, and then pigmentation.
So when we look at collagen in the skin and what it does, as we've said earlier, it treats not only laxity, but more collagen will give us a lifting effect in the skin. And when we look at Elise like this, we can see that there's a lot of sagging in the skin. And this is what results in the appearance of fine lines and wrinkles. So when we lift this, I think all of us do this in front of a mirror, it will address the sagging and the lack of elastin in the skin. Elise mentioned that she does not like the pigmentation irregularity, and what more collagen will do is it will brighten the skin, giving it more luminosity, life, and decrease the dullness that's there. So Sculptra is a treatment that is done in stages. It's not just once off. Elise is in her late 50s, and this means that she would benefit most from about 4 to 5 treatments done 6 weeks apart. What we are looking for is lifting of the skin, brightening of the skin, tightening around the jaw area, and lifting in the temples and in front of the ear. For us to do that, we're going to focus on the temple area and in front of the ear with her first treatment. To address these different issues, we'll have to do more than one treatment. The first treatment that we're going to do is basically a generic lifting of the tissue. And for that, we're going to address first the temple area and even into Elise's hairline. And we're going to work in front of the ear. Elise, give me a big smile so you can see that in front of this line, the skin is moving, and at the back of the line, the skin doesn't move with movement. So we're going to concentrate today for the first treatment on this part, going into the hairline. So this is a fairly simple treatment. It's fairly painless. We'll go ahead and do that right now. There are different techniques that can be used in doing Sculptra. The one that I prefer is to use a subcutaneous cannula technique. That means that I can get away with only making one little entry and then use the product, spreading it evenly with the use of a cannula. So this is what we're going to do for Elise today. As I mentioned earlier, we're going to use single entry. This is the cannula. It's a blunt little tube, and that allows us to feed the product in. Elise, was that painful?
Not at all.
Okay, so as I mentioned, we're going to use this product and stimulate collagen production all the way into the hairline. You can see that it's past the hairline already. There might be a slight tingle because we are using a little bit of lidocaine, which gives us local anesthesia as well. If you look closely, you will see how we position the product. And because this is a biostimulator, it stimulates collagen production throughout the skin, not only where we are depositing it. But this is where we want most of the product, and this is where it's going to give us that great lift. And this is something that happens over time. Collagen production is natural. It's a process that starts after a couple of days, usually from about day 10, and it's an organic process, but we'll explain that in a little bit more detail just now. So that was our first injection, and now I'm going to change my angle, and we're going to work towards the preauricular side. Nuala. Elise, so far, experience?
It's okay.
And now we're working in the preauricular area in front of the ear. And this will help to pull the skin back. Elise, again, comfort or pain during this?
No, it's just a tingly feeling.
Okay, a tingly feeling is because of the local anesthetic that stings a little bit before it starts working. So that was the first treatment done on the one side. As you can see, it's atraumatic, it's comfortable for the patient, it's fairly quick and painless. Results at the moment, you don't see a lot. This comes as the collagen starts being deposited, and that will give us a lift and pull of the skin, and it will work on the luminosity as well. So Sculptra being a biostimulator which stimulates natural collagen production, we want to spread this product evenly through the skin. So unlike with other aesthetic treatment, this is a treatment where massaging the treated areas are very, very important. There's a rule of thumb, and this is, we do this 5 times a day for 5 minutes and for 5 days in a row. So I'm going to show Elise how to do it. We've treated in the temple area and we've treated in front of the ears. So it's very easy. You use a cream, you can do this in the shower, before you put your makeup on, when you wash your face, and we just gently massage the area. So for me, a rule of thumb is we'd want to do this in the direction which we want to lift the skin. So it's usually upwards and towards the ears, backwards. I think all of us do that in the mirror, where we say, if only I can do this. So up and back, away from the eyes, towards the ears, and up to the hairline. As you can see, this is a procedure that's done very quickly, without any pain, and no one will say that Elize has just had a collagen stimulation treatment. Elize, just look at the camera a little bit. There you can see. Beautiful, easy, natural, and organic. Over the next couple of weeks and months, we will follow up with this treatment, and we will show you how Sculptra can organically and naturally improve the overall appearance of your skin.